Good morning. It's my pleasure to report the 7-year outcomes of the Avalus valve for the Paragon investigators. For disclosures, it's important to note that I am the North American principal investigator for the Paragon pivotal trial and the long-term follow-up study. The study sponsor is Medtronic, and the data analysis was performed by Medtronic. Bioprosthetic surgical valves are prone to deterioration over time. 5 to 7 years is a critical time to evaluate the durability and hemodynamic stability of new valves. This study analyzed the clinical and hemodynamic performance at 7 years of the Avalus valve in the Paragon clinical trial. The Paragon trial is a global study, including 39 sites and over 1,100 patients, with follow-up evaluating the safety and effectiveness of the Avalus aortic valve. Initially, Paragon was designed for 5 years of follow-up. However, follow-up has been extended to 12 years, with 19 sites agreeing to participate. 576 patients have reconsented for long-term follow-up, and 458 patients had reached the 7 years at the time of this data collection. The baseline characteristics demonstrate a fairly typical surgical aortic valve patient population, with an average age of 70, an STS predicted risk of mortality score of 2%, and 42% of patients in New York Heart Association class 3 or 4. 30% of patients had a bicuspid aortic valve. The majority of patients received either a 23 or 25 millimeter aortic valve. At 7 years, freedom from all-cause mortality was 83%. Freedom from cardiac mortality was 91%, and freedom from valve-related mortality was 97%. At 7 years, freedom from all reintervention was 94.3%, and freedom from reintervention for structural valve deterioration or severe hemodynamic dysfunction was 98.8%. In the Paragon trial, structural valve deterioration was defined as a change in the function of the heart valve resulting from an intrinsic abnormality that causes stenosis or regurgitation, with the diagnosis of structural valvular disease confirmed by examination of the explanted valve. With the introduction of transaortic valves in surgical aortic valves as a reintervention therapy, the surgical valve is no longer explanted, and therefore there is not always adequate information to definitively determine the failure mode and adjudicate to either structural valve deterioration or other failure methods. The severe hemodynamic dysfunction endpoint was used to categorize potential safety events that were characterized by severe AS, severe transvalvular regurgitation, or progressive severe dysfunction that did not have the evidence to meet the protocol definition of structural valve deterioration or non-structural valve deterioration. These cases were likely structural valve deterioration, but we were unable to be adjudicated as structural valve deterioration due to a lack of explanted valves from transaortic valves in surgical aortic valves. At 7 years, all reinterventions were 5.7%. Reintervention secondary to endocarditis was 3.8%. Secondary to structural valve deterioration or severe hemodynamic dysfunction was 1.2%. Reinterventions secondary to non-structural valve dysfunction was 0.3%. Secondary to thrombosis, 0.2%. And secondary to paravalvular leak, 0.2%. The reintervention rates at 7 years in patients 65 and younger compared to those older than 65 were similar. And low rates of reintervention for valve thrombosis, paravalvular leak, endocarditis, non-structural valve deterioration, and structural valve deterioration or severe hemodynamic dysfunction. The hemodynamic results remained stable through 7 years, with mean EOAs of 2 centimeters squared and mean gradients of 13.8 millimeters of mercury. At 7 years, 98.3% of patients had none or trace transvalvular regurgitation. At 7 years, 99% of patients had none or trace paravalvular leak. And at 1 and 7 years, nearly 80% of patients had no prostheses patient mismatch, and only 3.5% of patients had severe PPM at 7 years. At baseline, 42% of patients were in New York Heart Association class 3 or 4. However, at 7 years after valve replacement, nearly 95% of patients remained in New York Heart Association class 1 or 2. In conclusion, the Paragon 7-year results demonstrate excellent durability of the Avalus valve and continued low rates of mortality, reintervention, and structural valve deterioration or severe hemodynamic dysfunction requiring reintervention. Importantly, reinterventions were rare in both younger and older patients, and the hemodynamic performance was excellent and stable through 7 years. Thank you very much.